Good morning, everyone. We are a group of nursing students from Seattle University, and this presentation is part of our public health internship course. First, we want to thank you for your time and your willingness to engage with us today. We know that each of you bring years of experience and deep commitment to caring for residents with dementia, and we truly respect the work you do. Our goal today is to use this opportunity to share insight, reflect on challenges, and explore some strategy that research and best practice have shown to be effective in dementia care. At the end of the presentation, we would love to hear your insight, experience, and technique that have worked for you so we can all learn from each other. In this session, we are focusing on ways to enhance dementia care at Ages Living Kent by improving communication and strengthening connection with residents. Our goal is to share practical communication technique that we can make daily interactions smoother and more meaningful. We also want to emphasize a person-centered approach because as you all know, every resident is different. What works for one person may not work for another. Dementia care can be complex, but when we understanding the reason behind certain behaviors and use thoughtful communication strategy, we can make small adjustments that help reduce stress for both residents and caregivers.
According to World Health Organization, dementia affects over 55 million people worldwide, with numbers expected to rise. It results from a variety of diseases and injuries that affect the brain. Alzheimer's disease is the most common form of dementia and may contribute 60 to 70% of cases. And it is currently the seventh leading cause of death and one of the major causes of disability and dependency among older people globally. So, a little bit about dementia and what it is. I'm sure a lot of you guys are already aware, but just a little review. So, what is dementia? It is a general term for diseases that affect memory, thinking, reasoning, language, and the ability to perform daily tasks. It is a progressive condition that worsens over time and it mostly affects older adults, but aging does not guarantee its development. And we can also see it in younger patients, but it's mostly seen in older adults. Some of the causes and impact. So, it is caused by diseases that damage nerve cells and brain function. It leads to cognitive decline beyond normal aging. It affects mood, behavior, and motivation. It has physical, psychological, social, and economic effects on the individuals, caregivers, and society. And the stigma and lack of awareness creates barriers to diagnosis and care. Some of the risk factors, age, so like I said, older people, so people who are older than 65, high blood pressure and hyperglycemia, so diabetes, obesity and poor diet, smoking and excessive alcohol use, physical inactivity and social isolation, depression and low educational levels, air pollution, and cognitive inactivity. So, what are the signs and symptoms? Some of the early signs and symptoms that we see are memory loss, confusion in familiar places, losing track of time, difficulty solving problems or making decisions, trouble following conversations or finding words. Some of the signs and symptoms related to mood and behavior are anxiety, sadness, anger, about memory loss, personality shifts, and inappropriate behavior, social withdrawal, and lack of interest in other people's emotions. Signs and symptoms in the later stages, we see difficulty recognizing family and friends, challenges with movement, eating, and bladder control, and severe behavior changes, including aggression. So, what are the types of dementia? Alzheimer's disease, like I said, it's the most common. There is 60 to 70% of cases. And then we have other types, such as vascular dementia, which is caused by reduced blood flow to the brain, dementia with Lewy bodies, which is due to protein deposits in nerve cells, frontotemporal dementia, which affects the brain's frontal lobe, and other types of dementia that can also develop from stroke, brain injuries, infections, or alcohol related damages.
One of the biggest challenges in dementia care is communication. Cognitive decline makes it difficult for residents to find the right words or understand what's being said to them. This can be frustrating for both the individuals and their caregiver. Research suggests that nonverbal cues like gestures and facial expression can help bridge these gaps. Agitation and aggression are also common, often triggered by unmet needs such as pain, hunger, or overstimulation. Instead of relying on medication, behavioral intervention like redirection, validation therapy, and environmental modification are more effective in managing aggression. Vandalism and confusion are major safety risks. Residents may get lost, fall, or injure themselves. Strategies like secure environment, motion sensors, and structured routine can help reduce wandering. Family objects can also provide comfort and reassurance like a favorite blanket, family photo, or a favorite piece of clothing. Another challenge is resistance to care. Patients may resist assistance due to fear, a loss of independence, or simply not understanding what is happening. Using gentle persuasion, slowing down your movement, breaking tasks into smaller steps, and offering choices can improve cooperation. Person-centered care models, which focus on individual needs and preference, have been shown to be very effective. Moving on to effective communication strategy. When communicating with someone who has dementia, we need to keep our verbal language simple and clear. Using short sentences and one-step instruction can make it easier for them to process. For example, instead of saying it's cold outside, you should put on a sweater before we go to the doctor because it might be chilly in the waiting room. We can simplify it to it's cold, let's put on a sweater. Short sentences make processing easier. Speaking slowly and calmly also reduces their cognitive load. Suppose they don't respond right away. Instead of repeating it quickly, we should pause and give them time to process. If they don't understand something, avoid using do you remember? Try rephrasing or repeating it differently. For example, um, if a resident does not recognize their family in a photo, instead of saying, don't you remember your son? We can use gentle approach like this is John. He loves you very much. Nonverbal communication is just as important. Maintaining eye contact helps build trust and keep the person engaged. Reassuring facial expressions like smiling and nodding provide comfort. Gentle touch, such as holding a hand or light hand on their shoulder, can also help ease anxiety and strengthen connection. Next, for strategy for redirecting conversation and avoiding frustration. When communication becomes difficult, it's important to stay calm and patient. If a caregiver appears frustrated, it can escalate the person's agitation. A simple technique is to take a deep breath, lower your voice, and speaking in reassuring tone. Research show that caregivers who remain calm and actually lower anxiety levels in residents. One effective technique is positive redirections. If a resident fixated on going home, instead of saying you live here now for years, which may cause distress, try shifting the conversation. For example, tell me about your home. What was your favorite part? Redirecting that attention to a familiar, comforting topic can decrease repetitive behaviors and agitation. Another key strategy is to avoid agreeing or contradicting the resident. Dementia alters perception, so their reality may not match ours. Instead of collecting them, we can validate their feelings. Like if a resident say, I need to pick up my kid now, rather than saying, no you don't, your kids are grown, we can respond with, your kids might mean a lot to you. Tell me about them. This approach, known as validation therapy, helps improve cooperation and reduce distress. Lastly, offering simple choices can encourage participation. Too many options can be overwhelming for the resident, so giving just two clear choices is more effective. Instead of asking, "Do you want to take a bath?" which might get no response, you can try, "Would you like a bath now or after breakfast?" This approach fosters a sense of independence while still guiding that decision making. So before we move on, I have a short clip to show an example of redirection technique in action. I need my mother. Do you know where my mother is? Let me come around so I can help you, okay? Yes. How about we go look in your room, okay? You're okay. It's all right. You're all right. Here we are, back in your room. Do you have a photo of your mother so that I can see what she looks like? Oh, I wonder if she's here. Oh, what a wonderful picture. You all look so happy. Is this your mother? It's Mama. Look at that beautiful background. All those flowers. Thank you for showing me the photo, Willie. Thank you. Tell me.
Now we'll talk about nonverbal communications. First being facial expressions, keeping a neutral or pleasant expression, so making sure that you aren't making a frowning face. And second being body language, approaching residents from the front rather than from behind and maintaining an open stance and avoiding crossing your arms to not seem closed off. Third being your tone of voice or touch, using soft and soothing tone when speaking and using a slow pace of words to allow residents to process the information, and a light touch on the arm or hand to provide reassurance. Next I'll be talking about the hand under hand demonstration. So how it works is you'll extend your hand as if it's shaking, and you'll gently grab their hand and put thumbs together and slightly slide your hand up and around theirs and use your hand to guide their arm movements. So this can be used for when brushing your hair, the residents doing teeth brush, or feeding themselves. This allows them to have some autonomy and being able to do activities on their own. Next, we'll watch a video showing the demonstration for the hand-in-hand technique.
What would you like first? Let's try the soup first. Will you pick up your spoon? You're trying to have some soup? Here it is. Let's try it together. Looks like you enjoyed it. You ready for another sip?
This hand-on-hand technique allows patients and residents to have some autonomy in being able to accomplish their day-to-day life routine. And in the video, there was an example for feeding themselves and not having to assume they're unable to do, and it's good for their own muscles and dexterity. Next, we'll talk about some de-escalation techniques. Some early warning signs would be increased restlessness. This would be pacing, hand-wringing, or fidgeting. Some verbal outbursts, so repetitive yelling or refusal to cooperate. And third being physical tension. This could be shown as clenching your fists.
Some techniques would be adjusting your approach to give personal space. So don't stand too close to the resident and speak in a low and slow tone. The second being identifying and removing triggers. Some common triggers would be some of pain, hunger, thirst, etc. And checking to see if the resident is feeling too hot or cold or overstimulated by the noise. Third technique being to use distraction or redirection, shifting the resident's attention to their favorite activity. This may be puzzles, looking at pictures, or even watching their favorite film or talking to another resident.
So the final approach to caring for residents with dementia is through person-centered care. This type of care prioritizes the individual's preferences, needs, and abilities by ensuring that we meet them where they are in their journey. To effectively address these aspects, we must foster collaboration and encourage open communication between residents, families, and staff. This communication builds a foundation of trust and respect, which is crucial, especially when caring for someone with dementia, as they may sometimes struggle with understanding or expressing themselves. Additionally, it is important to validate the emotion of residents instead of correcting them. This validation helps residents feel heard and understood while also providing much needed emotional support. Engaging residents in meaningful activities that align with their interests, such as watching TV, knitting, or conversing with others, can also offer them a sense of purpose and connection. Lastly, it is vital that both staff and families encourage and promote independence for residents by allowing them to walk, eat, and perform personal tasks like toileting as much as possible can help them maintain their dignity and autonomy. Encouraging independence while still offering support when needed not only boosts their self-esteem but also contributes to their overall well-being. We will now have a activity where we will first pair up and role play a challenging interaction between a caregiver and a resident. There will be two scenarios, each will take around 2 minutes. And lastly, we will have a post brief / reflection with 3 questions. The first scenario is a resident is feeling frustrated and refuses to take their medication. They may say things like, I don't need those pills, or you're always bothering me. Nonverbal cues include frustration that looks like crossing their arms or looking away. So you can now pause the video for 2 minutes and we will be back to answer some questions regarding the interaction. The first 2 questions is to the caregiver, the responder in this interaction, as in what went well and what can be improved. And as a resident, the question is how did you feel about how the responder responding to the situation that is meeting your needs, or how did they handle it? Scenario 2. The resident is wandering and believes it's time to go home. They may say things like, Where's my husband? Or, Where is my wife? I need to leave. Nonverbal cues include pacing, fidgeting, or looking around. You may now pause the video for 2 minutes and we will be back to answer the same questions as before. All right, so as a caregiver, what went well or what can be improved? And as a resident, how did you feel during the interaction? I hope there are things that we learned and that can be improved in future practices. Okay, thank you for your time, and here are our references. Thank you.